100 questions and answers for doctor's competency test. Topic: surgery. 1. What is the classic sign of acute appendicitis? Answer: pain in the right lower quadrant, McBurney's point, nausea, vomiting, and low-grade fever. 2. What is the best imaging test to detect gallstones? Answer: abdominal ultrasound. 3. What is the main complication of incarcerated hernia? Answer: strangulation and intestinal necrosis. 4. What is the definition of hemorrhagic shock? Answer: significant blood volume loss causing tissue hypoperfusion. 5. What is the clinical difference between duodenal ulcer and gastric ulcer? Answer: duodenal ulcer pain decreases after eating, while gastric ulcer pain increases. 6. What is the most common cause of small bowel obstruction in adults? Answer: postoperative adhesions. 7. What is the first maneuver to manage a patient with complete airway obstruction due to a foreign object? Answer: Heimlich maneuver. 8. What is the classic sign of peripheral arterial disease, PAD? Answer: intermittent claudication, pain while walking that resolves with rest. 9. What is the main indication for surgery in chronic pancreatitis? Answer: uncontrolled pain or complications like bile duct obstruction. 10. What is the main symptom of perianal abscess? Answer: localized pain, fever, and swelling around the anus. 11. What is the primary management for thoracic trauma with tension pneumothorax? Answer: needle decompression in the second intercostal space. 12. What type of hernia is most common in men? Answer: inguinal hernia. 13. What is the main complication of perforated peptic ulcer? Answer: peritonitis. 14. What is the clinical sign of unstable pelvic fracture? Answer: hematuria and hypotension. 15. What is the definition of Wilms tumor? Answer: malignant kidney tumor commonly seen in children. 16. What is the primary complication of acute pancreatitis? Answer: pancreatic necrosis or pseudocyst formation. 17. What is the first imaging test for blunt abdominal trauma? Answer: fast, focused assessment with sonography for trauma, ultrasound. 18. What is the classic sign of right-sided colorectal cancer? Answer: iron deficiency anemia without obstruction symptoms. 19. What is the main indication for an emergency tracheostomy? Answer: upper airway obstruction that cannot be resolved with intubation. 20. What is the classic sign of paralytic ileus? Answer: abdominal distension, absence of bowel sounds, and vomiting. 21. What is the main risk factor for pancreatic cancer? Answer: smoking and chronic pancreatitis. 22. What is the primary treatment for intra-abdominal abscess? Answer: Abscess drainage and antibiotics. 23. What is the main sign of compartment syndrome? Answer. Severe pain disproportionate to the injury, along with paresthesia and reduced blood flow. 24. What is the diagnostic maneuver for ventral hernia? Answer. Inspection and palpation while the patient strains. 25. What is the main complication of head trauma with epidural hematoma? Answer. Transtentorial herniation. 26. What are the main symptoms of ruptured abdominal aortic aneurysm? Answer. Sudden abdominal pain, hypotension, and a pulsating abdominal mass. 27. What is the treatment for bleeding esophageal varices? Answer. Endoscopic band ligation and drugs like octreotide. 28. What is the classic sign of peritonitis? Answer. Diffuse abdominal pain, board-like abdomen, and rebound tenderness. 29. What is the main cause of arteriovenous fistula? Answer. Trauma or medical procedures like dialysis. 30. What is the primary test to confirm thyroid cancer? Answer. Fine needle aspiration, FNA. 31. What are the classic signs of hemorrhagic pancreatitis? Answer. Gray-Turner sign, flank bruising, and Cullen sign, umbilical bruising. 32. What is the indication for surgery in gallstones? Answer. Acute cholecystitis or complications like biliary pancreatitis. 33. What is the treatment for rectal prolapse? Answer. Rectal resection with fixation. 34. What is the most common cause of hemorrhoids? Answer. Chronic constipation and increased intra-abdominal pressure. 35. What is the primary diagnostic test for large bowel obstruction? Answer. Plain abdominal X-ray or CT scan. 36. What is the main complication of incisional hernia? Answer. Incarceration or strangulation. 37. What are the main symptoms of Crohn's disease in the small intestine? Answer. Chronic abdominal pain and diarrhea. 38. What is the main complication of abdominal trauma with splenic rupture? Answer. Massive internal bleeding. 39. What is the treatment for infected diabetic ulcers? Answer. Debridement and broad-spectrum antibiotics. 40. What is the most common cause of left supraclavicular lymphadenopathy? Answer. Gastrointestinal cancer, Virchow's node. 41. What is the main complication of acute diverticulitis? Answer. Abscess or perforation. 42. What is the primary indication for limb amputation? Answer. Critical ischemia that cannot be salvaged. 43. What is the classic symptom of pyloric stenosis in infants? Answer. Projectile vomiting and palpable olive-like mass in the upper abdomen. 44. What is the most common cause of acute mesenteric ischemia? Answer. Mesenteric artery embolism. 45. What is the classic sign of inflammatory breast cancer? Answer. Peau d'orange, orange peel appearance, skin changes. 46. What is the main treatment for subacute thyroiditis? Answer. NSAIDs or steroids. 47. What is the main cause of acute cholangitis? Answer. Obstruction of the bile duct by stones. 48. What is the main indication for bowel resection in Crohn's disease? Answer. Intestinal obstruction or non-healing fistula. 49. What is the hallmark sign of chronic subdural hematoma? Answer. Gradual mental status changes in elderly patients. 50. What is the main treatment for subphrenic abscess? Answer. Surgical or percutaneous drainage. 51. What is the primary treatment for acute appendicitis? Answer. Appendectomy, surgical removal of the appendix. 52. What is the gold standard diagnostic test for deep vein thrombosis, DVT? Answer. Duplex ultrasonography. 53. What is the classic triad of symptoms in fat embolism syndrome? Answer. Respiratory distress, petechial rash, and neurological symptoms. 54. What is the initial management for tension pneumothorax in the emergency setting? Answer. Needle decompression followed by chest tube placement. 55. What are the indications for emergency laparotomy in trauma? Answer. Hemodynamic instability, free air on imaging, or peritonitis. 56. What is the treatment of choice for testicular torsion? Answer. Emergency surgical detorsion and orchidopexy. 57. What is the most common complication after thyroidectomy? Answer. Hypocalcemia due to injury to the parathyroid glands. 58. What is the treatment for chronic anal fissures? Answer. Topical nitrates, calcium channel blockers, or lateral internal sphincterotomy. 59. What is the hallmark sign of ischemic bowel disease? Answer. Severe abdominal pain out of proportion to physical exam findings. 60. What is the most common cause of lower gastrointestinal bleeding in adults? Answer. Diverticulosis. 61. What is the definitive treatment for esophageal varices? Answer. Endoscopic band ligation or transjugular intrahepatic portosystemic shunt, TIPS. 62. What is the typical presentation of a strangulated hernia? Answer. Severe pain, erythema over the hernia, and systemic symptoms like fever. 63. What is the gold standard diagnostic test for breast cancer? Answer. Core needle biopsy. 64. What are the main risk factors for pressure ulcers? Answer. Immobility, poor nutrition, and incontinence. 65. What is the treatment for ingrown toenails? Answer. nail avulsion and proper nail trimming techniques. 66. What is the most common cause of acute mesenteric ischemia? Answer: embolism from atrial fibrillation. 67. What is the first-line management for acute cholecystitis? Answer: intravenous antibiotics and cholecystectomy. 68. What is the classic sign of a basal skull fracture? Answer: Bottle's sign, bruising behind the ear, or raccoon eyes. 69. What is the most common organism causing surgical site infections? Answer: Staphylococcus aureus. 70. What is the primary treatment for gangrene? Answer: surgical debridement or amputation. 71. What is the best imaging modality for diagnosing an abdominal aortic aneurysm? Answer: ultrasonography. 72. What is the hallmark sign of compartment syndrome? Answer: pain that worsens with passive stretch of the affected muscle compartment. 73. What is the most common cause of postoperative fever within 24 hours? Answer: atelectasis or systemic inflammatory response. 74. What is the definitive treatment for achalasia? Answer: Heller myotomy or pneumatic dilation. 75. What is the common presentation of a Meckel diverticulum? Answer: painless rectal bleeding in children. 76. What is the first step in the management of penetrating chest trauma? Answer: chest tube placement to manage hemothorax or pneumothorax. 77. What is the primary surgical treatment for severe GERD? Answer: Nissen fundoplication. 78. What is the most common cause of massive lower GI bleeding in older adults? Answer: diverticular bleeding. 79. What is the hallmark sign of pyloric stenosis in infants? Answer: non-bilious projectile vomiting and palpable olive-shaped mass in the epigastrium. 80. What is the treatment for varicocele in infertile men? Answer: varicocelectomy. 81. What is the most common site of intestinal volvulus in adults? Answer: sigmoid colon. 82. What is the most common complication after splenectomy? Answer: overwhelming post-splenectomy infection, OPSI. 83. What is the most common malignancy of the thyroid gland? Answer: papillary carcinoma. 84. What is the initial treatment for a patient with an open fracture? Answer: antibiotics, tetanus prophylaxis, and surgical debridement. 85. What is the typical presentation of intussusception in children? Answer: colicky abdominal pain, current jelly stool, and a palpable sausage-shaped mass. 86. What is the treatment for an anal abscess? Answer: incision and drainage. 87. What is the main risk factor for aortic dissection? Answer: hypertension. 88. What is the most common cause of postoperative urinary retention? Answer: bladder outlet obstruction or inadequate detrusor muscle contraction. 89. What is the treatment for a rectal prolapse? Answer: surgical repair, such as rectopexy. 90. What is the main complication of total parenteral nutrition, TPN? Answer: central line associated bloodstream infection. 91. What is the most common cause of small bowel obstruction in children? Answer: intussusception. 92. What is the definitive treatment for hydatid cyst? Answer: surgical removal with preoperative albendazole therapy. 93. What is the most common cause of hematuria in blunt abdominal trauma? Answer: renal injury. 94. What is the treatment for a pelvic fracture with hemodynamic instability? Answer: pelvic binder and angiographic embolization. 95. What is the hallmark sign of a hepatic abscess? Answer: fever, right upper quadrant pain, and elevated liver enzymes. 96. What is the initial management for penetrating neck trauma? Answer: airway control and evaluation with CT angiography. 97. What is the most common cause of chronic venous insufficiency? Answer: incompetent venous valves. 98. What is the hallmark sign of Boerhaave syndrome? Answer: severe chest pain following vomiting, with subcutaneous emphysema. 99. What is the treatment for splenic rupture in a hemodynamically stable patient? Answer: non-operative management with close observation. 100. What is the treatment for a periampullary tumor? Answer: Whipple procedure, pancreaticoduodenectomy.